Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is July 30th, 2025. This video is on a JAMA article published online yesterday, July 29th, titled Managing Adverse Effects of Incretin-Based Medications for Obesity. Welcome to today's podcast, where medicine meets meaning. The goal is to tolerate, tailor, and triumph. Today we are unpacking a topic that's changing the landscape of obesity care, managing side effects from incretin-based therapies like Semaglutide and Tirzepatide. These drugs are powerful, yes, but they're not without potholes in the road to better health. Let's dive in, one step at a time. Easing the upset stomach. These therapies often begin with a bump, the GI side effects. Did you know nausea affects up to 44% of the users, diarrhea up to 31%, and vomiting up to 25%. Many of these side effects are mild, peaking within 48 hours of starting or increasing the dose. How to soften the blow? Start low. Semaglutide begins at 0.25 milligrams. Tirzepatide at 2.5 milligrams. Titrate monthly based on tolerance, not just target. Smaller meals, slower eating, and avoiding rich or greasy foods can help. Short-term antiemetics like ondansetron and fiber-based laxatives like psyllium can rescue the gut when it protests. Around 6 to 10% in trials stopped due to side effects, but observationally 53% dropped off by 1 year. Clinical pearl: if one doesn't work or isn't tolerated, try another. Patient responses are often unpredictable. Supporting change. Now let's talk food and movement. These drugs suppress appetite so well that patients may skip meals or fall short on nutrients. Pro tips: prioritize diet quality over caloric restriction. Lean proteins like fish and legumes, healthy fats from nuts and avocado, and colorful produce are key. Both aerobic and resistance exercises preserve not just weight loss, but function and longevity. Teamwork matters. Dietitians, trainers, and psychologists can all help reinforce healthy habits. When a dose is missed, life happens, and so do missed doses. Before surgeries with general anesthesia, these meds must be stopped 1 to 2 weeks in advance because they slow gastric emptying. If 2 or more doses are missed, restart at a lower dose to prevent GI backlash. This is especially important in patients with prior GI trouble or kidney disease. Too much, too fast. Semaglutide typically leads to 15% weight loss. Tirzepatide about 21%, but more isn't always better. What's safe? Losing about 0.5 to 2 pounds per week. If someone's dropping more than 5% a month or less than 5% in 3 months, it's time for a check-in. Older adults risk sarcopenia, loss of muscle and strength. Assess with a sit-to-stand test or hand grip and act early. Encourage at least 1.3 grams of protein per kilo per day and resistance training twice a week. If function suffers, dose reduction or discontinuation should be considered. Keeping it off, let's talk sustainability. Discontinuing these meds often leads to a rebound, regaining up to 2/3 of lost weight in a year. And here's the rub: hypertension and diabetes may come roaring back. There is no universal guide on long-term incretin use, so flexibility is essential. Options include lower doses, switching to generics, or emphasizing lifestyle and weaning off meds. Golden rule: shared decision making. Understand the patient's goals, constraints, and preferences. Success isn't just about the scale, it's about lasting, livable health. Closing message: incretin-based therapies can be life-changing, but the journey requires navigation, nuance, and nourishment. With personalized care and proactive side effect management, we don't just treat obesity, we transform lives. This podcast is to remind you, the doctor, medication is a tool, not a crutch. The real cure lies in commitment and compassion. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.